Hello, my name is Geneva, and today I'm going to be discussing medical marijuana, with my proposition being medical marijuana is a positive medical benefit for treating a variety of patients. So what is medical marijuana? According to the National Institute on Drug Abuse, medical marijuana is derived as the whole unprocessed plant or its basic extracts to treat symptoms of illnesses and other conditions. There are different ways to use marijuana. There's the medical marijuana, and there's the recreational marijuana, which is more of a casual use. This poses the question, what is the difference between the two, and why do we specifically use medical marijuana to treat patients? According to Professor Oyedi Ayorindi, he says the higher the cannabidiol, aka the CBD in the plant, to the tetrahydrocannabidiol, aka the THC in the plant, the more appropriate it is to use for medical consumption. Medical marijuana is focused on the variation of that CBD content. CBD is directly derived from the hemp plant, which is a cousin of the marijuana plant, which doesn't cause the psychoactive effect from THC, which causes the high that you get when you use it for more recreational use. This leads me into my three main points on why medical marijuana is a positive benefit for treating a variety of patients, which are that it helps anxiety, helps alleviate symptoms from cancer, and is used in treatment in pediatric resistant epilepsy. There are millions of people around the world living with anxiety, with a study of research which was conducted by the World Health Organization in 2017, finding that nearly 264 million people around the world live with anxiety. There are many propositions and treatments to help alleviate anxiety symptoms. One specifically is CBD usage. CBD can affect serotonin levels, which is a neurotransmitter which plays a huge role in our mood swings. Using the form of CBD in the form of a CBD oil can help relieve anxiety, depression, and even stress. But is CBD oil effective? The answer is yes, because according to a 2010 paper published in the Journal of Psychopharmacology, human and animal studies have conducted that cannabidiol, the primary compound in the marijuana plant, is a practical treatment for anxiety. Therefore, it being a benefit and a more natural form of treatment for patients with anxiety. There is no denying that when it comes to treating the symptoms from cancer, there are many ways to help relieve the pain from it. One of the up-and-coming and popular usages is the use of cannabis, aka medical marijuana. With Medscape and WebMD conducting a poll in 2014, they found that 82% of oncologists agree that cannabis should be offered as a treatment option. CBD research for cancer patients has led to the development of a variety of drugs, such as Marinol, which is a FDA-approved drug for nausea and vomiting from chemotherapy, as well as Sativix, which is derived from the plant and is used in the form of a mouth spray. Using medical marijuana as a form of treatment for cancer patients is not only extremely effective as a more soothing alternative for treatment, but is also less likely to cause nausea and addiction that can come from prescription drugs like narcotics. Since they are using CBD, which again doesn't have these psychoactive effects or that high that narcotics can have. My last point is discussing the positive effects that cannabidiol-enriched cannabis has for children with treatment-resistant epilepsy. Childhood epilepsy begins in the very early point of a child's life, which can lead to long-term effects such as seizures, neurodevelopment delay, and impaired quality of life. This has led to a group of parents on Facebook discussing the use of cannabidiol-enriched cannabis to help their children's seizures. Obviously, these young patients aren't going to be using it in the form of THC because that high would not help them at all. It would probably worsen their symptoms. In this group study, discussion, the data collected revealed that 84% of the parents reporting in a reduction in their child's seizures while taking this drug. There was also reports that it helped with alertness, mood improvements, and improved sleep. Medical marijuana has positive medical benefits that can appease and treat a variety of patients, which is why I agree that it should be in usage. It can help with nausea, cancer treatment, anxiety, and many other forms across the board. This approach is a more natural way since it is a plant that grows from the ground up. Thank you.
All right, well, the proposition's there at the beginning. There's a pretty solid preview of what the supporting structure is going to be. There is some dispute about these issues, although you don't really tell us much about what the controversy is. I'm not sure there's a lot of controversy, for instance, on Marinol, since it's already been approved by the FDA, but some of the others there might be some question about its effectiveness, and I think you need to give us a little bit more context on why we have to have this argument. I know what your main points were when you listed them in the preview. There's not really a very clear signpost as you get to those individual points. I know the first point you started on, but you don't remind us what it is. When you got to the second point, I just happened to remember that it was cancer. So when you got to cancer, I knew that was going on. The third point was a little generic, but I could tell that it was there. I just think your signposting needs to be a lot sharper on the structure of the speech. Evidence. Some of the statistics that you present really are, like we talked about it, we called it public opinion surveying. That last study that you present, it's a self-reported parents group talking online about how many of them thought that it had an impact on their children's issues that they were facing with the seizures and the epilepsy that was going on there. As evidence, it's probably a good start for a general argument like this. In terms of being convincing, I think you probably need some additional information there because, like a poll of Facebook users is not exactly the kind of thing that is going to be overwhelmingly convincing to a lot of people. The argument that you had on the first point talking about how the relationship between the CBD and the THC gives us the greatest indicator of whether or not it has a medical use. I appreciated that. The number of people who are suffering from anxiety. I do think there needs to be a little bit more explanation about anxiety because basically, that just means if you're having a tough day, I need to unwind with some marijuana. I'm not exactly sure that that's really what you're talking about. It seems like it's something a little bit more serious than that, and so we need a little bit more data on that particular point. There's a lot of reading, and it felt like you were rushing during the presentation, so you can pace yourself a bit more and probably practice. The term natural came up 2 or 3 times in the presentation. There's not really any argument about why natural is a good thing, why it's important, what differentiates it from other kinds of pharmaceuticals. So unless that's going to be part of the argument, that's something you can probably take out. All right, thank you.